let me share with you why I keep, going this webinar and this reason on the foot care. Okay, and today you're gonna have 10 tips to give you a better understanding why this foot care is so important. So let's talk about how to protect your feet and leg for a pre-diabetic diabetic patient. Managing your feet is really one of the most important daily tasks. Okay, typical diabetes, there are two major common problems. Is really the foot and leg. Okay, now any kind of problem is like when your shoes, you have corn, bunion, blister, ulcer, all these are very high risk for the diabetes. The reason is you have that blister will pop. The pop is going to get infected. So you got to make sure that it is well protected. No corns, no calluses, no blister, no bunion. All these are the cause of starting of your journey of losing a feet. And I don't want you to get that journey. Okay, a lot of people already ask, I'm pre-diabetic, why should I have to keep myself in good shape? Okay, and how do I do it? You got to start looking at better footwear. And the footwear is meaning that you got to cover your foot all the time at home and outside. And you have to regularly examine your feet and do exercise on foot and massage your foot. So a lot of people will ask, why foot complication happen to pre-diabetic diabetes? And that's kind of unfair for us, really, because high blood sugar is already bad enough, but why happen to us? Really, when you have high blood sugar level, the blood sugar in the vessels start damaging the nerves, and it doesn't give them enough nutrition, and so the nerve become less sensitive. So when nerve damage, you have what they call a symptom called diabetic neuropathy. Where the nerve cannot feel. And unfortunately, 70% of the diabetic patient will have some form of diabetic neuropathy. Wow, imagine that, 70%, my friend. So it's a high percentage. And then you start losing a feeling of feet and hand. And then if you have a cut, sores, and then sometimes they even have pain, you don't feel it. And so net result, you lead all that to gangrene result, you will amputate. So you got to really take good care of that, okay? Many pre-diabetic, diabetic patients, they start up usually a dry skin. And that is the most common symptom. The skin becomes very dry. This is due to the neuropathy that started off when the brain basically are not properly getting a signal. They don't tell the foot to start getting what? Putting sweat out. So there's no sweat. The foot is not being get moisture. So it's not getting cracked. A germ can enter to the crack of the body. And so sometimes even the shoes that will fit well, it no longer fit well. Now, all these actually come with a long period of time, maybe 6-7 months, a year. You need to really ask yourself if my shoes is comfortable. So you got to look at that. Is the shoes giving you a lot of friction, like inside there some letters come out and then forming calluses and bunions. And your vessel become also blocked and it can start shrink and harden. Result, those infection also get extremely hard to heal. So you got to start taking care of that and be notice all the micro changes along the way. So how do you better manage your foot? Okay, one, you need to put lotion to manage your your skin to prevent crack, and you have to make sure the color of the skin are continue to be healthy. Okay. And then a lot of time you might have a mirror because a lot of people are kind of chubby, cannot look down the foot, or can you lift up their foot. Then you might need a mirror or ask your friend or your relatives or your wife to look at your foot every day to check, see whether the area you can see, whether are there any sign of infection. So we'll give you the 10 tips how to protect your feet now, okay? 10 tips. The first tip is never test your water to say, hey, is the water hot enough? Now, you're diabetic, never do that because the water could be too hot and it burn your foot because you have nerve damage. You are not going to feel the heat or the pain. You might end up with a blister. If that, you will be infected. Do not do that, okay? So the second one is you have to wear diabetic friendly footwear or socks, okay? Your shoes has to be very round in the front so it doesn't get pointed toe. You will not basically get restriction. Secondly, you have to wear padded socks, like thick cotton socks, give the absorption of the moisture and soft to touch. So you have good impact protection. I know we have a lot of friends from Hawaii. Unfortunately, a friend in Hawaii, and I think in Hong Kong too, a lot of people, and I think in Philippines, the same thing. A lot of people don't wear shoes in the house. Now, is that a good idea for diabetic? To be honest, no. If you have cover footwear, at least any kind you hit, you won't hit your toe, you will hit your foot, you will protect it. Get a slipper with cover will be really much better than you just barefoot, okay? You really need to reduce the risk of infection, keeping your feet dry all the time. The sock get real wet, moist, and dirty. You have to throw it in the wash. You have to have moisturizer to prevent dryness and cracked skin. All these are part of your daily routine to keep your feet clean and dry all the time. So tip 5, how often do I go to see a foot podiatrist? A lot of time you really need to have professional to keep looking at feet, especially a podiatrist. You should at least have every 6 months to see him once to see any kind of nail that is ingrown toenail, need your help to get it fixed. So this is something that you need to check. Don't let it get worse and then go to check. It will be too late. Okay, as time goes on, your feet will go to change, and you need to have good arch support to help you. So you have to Orthotic insole to counteract, like the insole of Orthotic, meaning the sole, there's something that with arch support to help you to balance, which you have to actually invest to buy. But I think it's a good thing to do because you restore your foot to a more natural position and make your feet become less chances to form in a wrong position. That result affect your bone, your ankle, and your feet is not functioning well. So the 7 tips is you have to actually a lot of low impact exercise. That's mean you have to walk, you have to swim maybe, and make sure you walk with good pair of shoes. Do not walk with shoes with very thin sole. So to improve the foot circulation, besides cutting off your cigarette, but more important, you have to daily massage your foot, increase circulation. You have to control your blood sugar, avoid diabetic neuropathy. That will be the ultimate tips that you have to do. Your high blood sugar will continue to damage your blood cells, so you gotta control that. So how do you do that? Because this is a long-term process. So you have to drink Lowsutea, take low carb diet, low cholesterol diet. You have to exercise 150 minutes in a week. Your weight control, BMI has to be less than 23. You have to continue to monitor blood sugar daily, ensure blood A1C will drop down below 6.3. You have to join a webinar. Last but not least, take a diabetic medication daily. The last but not least, the last tip is you have to work with your doctor. You really gotta continue work with doctor, work with them, measure A1C, measure LDL, your cholesterol, and lower your BMI, stop smoking. Make sure to check your feet every day, prevent any kind of infection. If there's infection, don't wait. Make sure to see the doctor as soon as possible. So very important, work closely with doctor because that's the only way you can keep yourself healthy. You gotta remember, pre-diabetic client, managing your feet is truly your daily essential task. Okay, is a task that you have to keep up with the rest of your life. And if you are not doing it to prevent the infection, you may end up losing your feet. I hope this webinar give you this tip to help you, alert you, so you can able to really protect your feet from being cut away. I hope you continue to listen to our webinar. I appreciate your busy time and thank you very much to participate. Okay, thank you very much. Have a very nice weekend. Take care. Bye-bye.